Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
We're going to talk to someone very special today, someone in the medical profession, but with a big job. You know, it's one thing to be a private physician, but then when you're in charge of a lot of private physicians, it's a bigger job. And Dr. Dan Westphal is here to talk about, of course, his new position is as Chief Medical Officer of Broward Health. But before we get started, Dr. Westphal, I want to know, how does a distinguished person like you even get into the medical world? Was it your mother, your father? Was it a brother?
Well, actually, I was the first one in my family to go to college. And
Where did you live?
I lived in South Central Kansas, which is where I grew up, in a small town of less than 200 people. Graduated from a high school with a class of 8 people. And there'd only actually been one other person who'd ever gone to medical school from the town, as far as I know, from the high school. So, yeah, it's been a long, interesting journey.
And what really, was it a teacher? What really got you interested?
No, actually, when I was growing up, my mother used to talk about my late brother. And he was 9 years old when he died. And he died due to probably, in those days it would have been not considered malpractice, but in this day and time it would have been considered malpractice, and certainly, if nothing else, delay in diagnosis and treatment. But what happened, he injured his leg. He had been with my parents on a trip, and he and my older brother, the brother older than him, decided they wanted to race down a little slope in Colorado where they had stopped, and there was some ice, and he hit his leg and kept complaining of his leg, and it turned out he had osteomyelitis of the leg, and he died before they could amputate his leg. So that was really the impetus, and that was the real driving force behind me going into medicine, was just the fact that I thought that he died needlessly, and I really always felt that, you know, if I did anything, and certainly going in the medical profession, I wanted to do it to the best of my ability.
Well, you certainly have created that. And what was your brother's name?
Kenny.
Kenny.
Mm-hmm.
And there probably isn't a day that you don't think about him.
Well, I think about him not as much as I used to, but I used to, you know, that's always in the back of my mind when anyone ever asks that question, because I always think about that was really the driving force. And I always thought, well, if I ever had an opportunity, I could get to that point where I was a physician, and I'd certainly try to impact the lives of many people rather than just one.
Okay, so now you have this dream of becoming a doctor, but it wasn't so easy. You're from a small town, and you first had to go to a college. And was that easy for you? Were your parents...
Well, no, actually, I think from an academic standpoint, of course, anything that's worth anything is a lot of hard work. And, you know, my mantra has always been excellence in all things. And, you know, no matter what it took, I was going to really get the grades to the best of my ability. But, no, the financial part was really difficult, because I came from a family where my parents, you know, my dad owned a very small service station in a small town. He was the sole provider, and so we all learned to work as we grew up. And you know, I think that work ethic really probably had a lot to do with, and taking responsibility at an early age probably was the best teacher I could have had. No amount of money would have probably ever taught me what I knew when I was probably in my teenage years. A lot of people don't know until they're way further in life.
I agree, and it certainly has helped a lot of people, but you especially, because you always seem to be humble, and I think that comes from humble beginnings, and so you always know who you are, especially coming, you know, from where you lived. All right, so now you get into college. Where did you go to college?
Went to college at Fort Hays University in Hays, Kansas, formerly known as Fort Hays State University.
So you're a Kansas grown?
Kansas grown, and then from there I went to medical school at KU, University of Kansas, and spent 4 years there, and loved every minute of medical school. Well, I love college, but I love medical school more because it was really just my passion. And actually ended up interning, doing what's called a straight medicine internship, where instead of a rotating internship, I spent all 12 months in internal medicine and in internal medicine subspecialties. And then I was going to stay on there and actually had a spot. I decided to do pulmonary medicine, and that's another kind of interesting story in and of itself. But
yeah, Tell me.
Well, I was a second-year student, and we at Kansas used to take clinical responsibility for patients at an early during the early part of our career. We didn't wait till our junior or senior year. We actually started in the clinics when we were sophomores, second-year students. And I had a lady that came in, and she was a middle-aged to elderly Afro-American lady, lovely woman, and came in, and she said, I can't sleep, I can't breathe, I can't walk. My life was miserable. Her legs were swollen. In retrospect, she really didn't have a pulmonary problem, and I knew that at the time, but she had a condition called congestive heart failure. So I conferred with my attending who was there and prescribed medications for her and told her that I wanted to see her back in the clinic in a week or two. So I think it was a week, and I saw her, and she came running down the hall and hugged me, said, I just can't tell you what it's like to be able to breathe.
What did you do to help her breathe?
Well, actually, I put her on some medications that got rid of the fluid and then also helped her heart function better. And
you're only in your second year.
Only my second year. That had such an indelible effect on me that I always thought, if a person who is short of breath is that grateful, that's something I really want to do. During those days, most of the people that, were interested in what I was interested in went into cardiology. And in fact, I was approached to be a cardiology resident and fellow, but instead I decided to do pulmonary instead. And was under the tutelage of some very good people at the University of Kansas. Late Dr. Bill Ruth was the chairman of the department. He had quite an influence on me. And so then, I decided to do that, and I was going to stay at Kansas, but then Uncle Sam decided that during the Vietnam War he needed me. And the way it worked then wasn't by lottery for physicians. It was actually by age. So the youngest were drafted first, and I was the fourth youngest in my medical school class. But it was a great experience. I always like to think if you get lemons, you make lemonade. And, I did spend 2 years at Fort Knox. I was going to go to Vietnam, but then the orders were canceled a couple of weeks beforehand. But I had such a tremendous experience because I ended up running the emergency room, being in charge of the emergency room there. And it was a phenomenal experience. In fact, I was a 3100 called a general medical. It's a 3100 known, it's not even in existence today, known as the general medical officer. But I got so much experience and had a lot of great physicians working around me that, would teach me subspecialties, for example. Anesthesia showed me how I spent time with them so I could put a tube in a person's throat so that they could breathe. Did a whole lot of different procedures and so forth under their tutelage. And a lot of the fellows that I worked with in the Army actually went on to academic careers. So,
I was thinking about Dr. El Sanati, of course, who also was emergency medicine,
Yes,
so that's
yes.
why the relationship has
Yes.
been so strong with you. But as an asthmatic, I have to tell you, I don't have it all the time, but in certain instances, I can tell you how important a pulmonologist is to us when we can't breathe. So that was good that you did that. But then I guess you found yourself liking administration.
Well, I spent roughly 20 years practicing at North Broward, and which is in Boca Community, now Boca Regional. So that's where I spent most of my career, all my career when I was in practice. And then we started the sleep center there, and I ran that for almost 10 years at North Broward, in addition to us practicing pulmonary and critical care medicine. But I ended up having a series of medical issues, surgical issues, which really left me in a position where I couldn't go back to my practice. So it wasn't something that I chose to do. It's something that actually fell upon me, and it was a wonderful thing because I used my judgment and, my prior training, in my job, and I'd held a lot of different medical staff positions at North Broward and at Boca. So it really kind of put me in a good position. So the CEO there, when he was new, asked me to be the chief medical officer, which I was then the chief of staff at North Broward. So I went on to be chief medical officer, and then was at Boca, and then at Boca went from there to Florida Medical Center after 5.5 years, and 4.5 years at Florida Medical Center, and then down to South Broward, where I worked in the memorial system, and I loved it. Probably the best team of people I've ever worked with. And then it ended up that Dr. El Sanati, who's now the new CEO and president of Broward Health, had called me. I looked back on my text. It was 2 days after he actually was chosen to have the job and asked me if I'd do it. And we've talked a lot, and I decided not to 3 or 4 times, but then he's very convincing. So it's been a great change. It's a big change going from a hospital chief medical officer to a systems chief medical officer. There's a whole different level of concern and objectives.
Well, wow. So it's great to hear the history, though, because I don't think a lot of people really realize when they see a name, chief medical officer, what that really encompasses. And what makes me feel is, wow, you've been there, you know what's going on, you know where the bugs are, what you have to take care of, and you are such a very gentle, sweet person. And I think that doctors and staff, all the great nurses, they need someone like you, someone that understands it isn't just you have a lot of business you have to take care of, but you really come from a medical mindset. And I know so many of the doctors, and they are very wonderful, but they need support.
They do. And I think the nice thing that I've always told the physicians, in fact, I've told the physicians at every one of our 4 Broward Health facilities that I'm a physician first and an administrator second. But they know that I was in the trenches. They know, what kind of work I did in the past. So I think that's kind of helped this situation as far as people knowing me. But I think it's been very difficult to come into this system new and not having known people. But that's helped, and I think people know that, I want to try to work with the physicians. Now, doesn't mean they're always right, so I have to tell them sometimes, no, you're on the wrong path, but I do it in such a way that I think that they understand the rationale. It's not, I told them that I'd never drive anything from the top down. I always like to build consensus whenever I try to do anything, and, whether that's just with the medical staff or with administration, because you can't do it by yourself.
Well, I think we're very privileged to have you here, Dr. Dan Westphal, who really has a big job ahead. Of course, being on the Broward Foundation board myself, I'm so impressed with everything I'm seeing and all the great hopes for the hospitals and the Children's Hospital and all the expansion. We live really in a great county because they're so supported. I know that we are, the 10th largest in this?
I think the 9th largest public health care system in the country. And it's we were just really pleased today because we got back our employee satisfaction results, and they're the best I've ever seen, way in the high 90s, where most hospitals are in the 70s. We're in like the 90s. We had a 90+% participation rate, 92% I believe, or 93%, which is like unheard of for people to participate. And, everybody was very favorable. And I see it as a place to work where people want to mentor each other. They want to support each other. And I think that goes a long ways in terms of young staff particularly, and even older staff, to form those relationships where they feel that they're being supported. And that's one of my big jobs. I feel that, it's not just physicians that I work with. I've been working a lot with nurses. I have oversight of the medical staff offices, and also quality. And I also do a lot of work with case management. So I have 2 wonderful people who are working with me that I hired. B. Tome, who's my director of quality. She comes from Memorial, very, very experienced, very knowledgeable, and she's bringing with her a senior statistician who'll be working with me when we start to look at this data and making sure that the data is correct. And I brought over a lady that I've worked with for years to be the director of my medical staff services, Kathy Ellis, who's without a doubt the best person I've ever worked with in the medical staff office, save for maybe one person, and that was the lady that works at Boca Community. She's very good. So, anyway, I'm very fortunate to have a wonderful team.
And Dr. Westphal, the reason this is also important is because we have a lot of people listening who have to go to the hospital, and they walk in, and of course they have to fill out the forms, and they have to go to a room. Maybe they're in the emergency room, and they don't feel the things you're talking about. They feel who's taking care of them, what's happening right then, and does someone care about them? And that's why this is an important conversation, because I think if they hear you, they know that someone's watching over all that. It just doesn't happen like magic.
No, it doesn't. And I think it's got to be a team. Having run an emergency room in the past when I was in the Army, and that's many years ago, but I know, in having been an intensivist, how critical it is to have teamwork, There's nobody out there that's taking care of the patient by themselves, be it the doctor, be it the nurse, be it the technician. Everybody has to work as a team. And, I think one of the things that's really hard to do is when you have a person in the emergency room because, they're sick and they don't feel good. That's a place where you have to, I think, extend special compassion, special care. And I think, having just recently had an experience with a friend who his father is living down in the Bahamas, and he needed to come up here for medical help, and he was very sick and came, and I directed him to go to Broward North because that was the closest. And so what I really saw there was just tremendous teamwork, and I really saw it just firsthand, just the team. And these are a lot of people that I used to work with, which was also very comforting. But, I think that the thing I like about Broward Health is people go there and they stay there because they like the environment.
I just wanted, and as a gerontologist, I just want to pick up on something that you said. There are so many elders living in Broward County, as we know in South Florida, and when that person is taken to the hospital and there's no one with them, what happens there in the emergency room is so critical. It's like if your mother were to be there and there's no one to hold the hand, but I have seen how the nurses and people just take care of them so kindly, and that's something you don't always get at hospitals.
It's true. I think that one of the things that I want to instill in our staff is, when you're taking care of someone, that's a sacred duty. It's a sacred trust when people put their lives into your hands. And I think that you have to keep in mind that, if you were treating your mother, do you want to treat that patient the same way? Because you want to treat that. I always want to treat the patients the way I would want to treat my mother.
That's right.
And I think that says a lot.
Well,
in terms of how we feel about it. Yeah.
If when they tell me to do something, I say, "Is that what you would tell your mother to do?" Because that's true. You have to think about it. But I'm also very impressed, and I've had a lot of relationship with the Broward Imperial Point. And it's funny, you can walk down the halls, and you don't know any of these people. They're on the staff, and they smile, and they're so nice to you. And that's not something hospitals were famous for. No,
they're famous for being very cold, aloof, unwelcoming, and, being alone. I mean, there are a lot of people that just feel alone, and sometimes just going up and talking to people, just makes them feel like they're special. I don't get to do that as much as I'd like to, but because I'm really more corporate-based now, but I think it's always really refreshing. And I've had people where I've gone up to see them where somebody knew somebody. You go up and see them, and you talk to them and pray with them, and it makes a big difference. People say, "Well, I'm glad to see somebody who is a friendly face," and I think that's what we're really striving to do with all of our patients is to make that connection between the nurses. We're really trying to work on rounding teams where just instead of the doctor going by himself, we need to make this an effort where there are other people on a team that are rounding with him. And you can do that expeditiously and try to certainly make the workflow go smoothly. Doesn't always happen, but you can have a significant number of people, 4 or 5 people. You got the nurse, charge nurse, you got the case manager. Sometimes you'll have the pharmacist, sometimes the dietitian, and others that'll join you on rounds. And all of them have an important role to play in terms of sometimes rehab, respiratory therapy, but you have a team and you get to really hear the whole picture. Because you can read things about a patient in a record, but it's really that interaction. And I'm still a big one. Even though I text and I send emails, I still think that the face-to-face communication is the most important.
Just like we're doing here today.
That's right.
You could have called in, and here you are sitting in your gorgeous outfit, ready to go to another meeting. I want to also compliment you on the CEOs. Each of the CEOs of the hospitals, each are different, and each hospital, of course, has a different specialty, but I'm going to just tell you that something else that has been instituted are the public relations. Once every 2 months we meet, and now I know, especially at Imperial Point, there's a physician that does some sort of a talk, a lecture, and we just heard someone on bariatrics, and it's wonderful, and people feel so good. And we just celebrated a nice volunteer luncheon. Dr. El-Sanati was. I didn't see you there.
No, I didn't. I think I had something else going on.
But all those things, and I stood up and I said that hospitals used to be a place you never wanted to go. And now, with all the big things we're doing at hospitals, it's like almost part of the community center.
And it should be. I mean, the hospital should be an extension of the community, and I think that's the thing that we're really doing now. And I'm especially proud of Broward Health because of the outreach that we have to the indigents and to those that don't have anything. And we're really trying to work now a lot with the veterans, working with the chief of the staff down at VA in Miami, who's a good friend of ours, good friend of mine, good friend of Dr. El-Sinati, in terms of trying to help those veterans that need help. Because, sometimes they can be a real lost population, and it's unfortunate.
Yes, and also I do have to salute the volunteers. I mean, I go into the gift shop, the volunteers, and I'm going to bring up Imperial Point again. I can never leave there without spending at least $20, $30 because whoever's buying for your gift shops, I mean, it's a way for you to get more money, but they're so sweet. They're so nice. They're not getting paid. I asked them, they said, well, they work 4 hours twice a week or something. Volunteers are the key to the hospitals.
Oh, they are. I've always maintained that. I think the volunteers are really the key. They're the unseen or untalked about, if you would, force, I think, that really can make a huge difference. And, we've had patient care representatives and we've had volunteers that have been invaluable in the hospitals where I've been. They just became part of the fabric. They became part of who we were.
And it's important to the volunteer.
Absolutely.
Because so many of them don't have a place to go, and now they know they're going to go once a week, twice a week, and that they're important and people care about them.
Right.
So, the whole thing with hospitals now is that if you need to go to the hospital, we don't really want to go to a hospital, but if we have to, it's not going to be that we're never going to leave, because that's always been the thing. I don't want to go to a hospital because I'm probably going to die there.
That's right. Yeah, that's right. But you have to remember that the vast, vast, vast majority of people survive. I mean, sometimes we have elderly people. Sometimes we have people that are extremely sick. And, they have a life-threatening condition or situation. And so, you can't save everyone. But I think the old thought, and, of course, the original hospice was where, was in France, run by the nuns in Paris, where they actually, they call it, the word hospice came out of that in hospital because they actually provided care for those that were blind, those that had cancer, those that basically had end-stage disease or didn't have any place to go. It was really more of just a respite, if you would, where they could get meals and get care. And, of course, I'm sure it pales in comparison to what we have now, but that's really how it started. And I think you start to think about, what really started at, and you think about people like Mother Teresa, and the compassion that they show, that's, I think, one of the things, and I think a lot of these things came out of religious orders, in terms of, the Catholic Church and, certainly we know out of other religious organizations. But I think that, we have to keep in mind, again, that, it's not about the doctors, it's not about the nurses, it's about the patient in the bed.
That's
and
right.
We got to keep our focus.
And there's a saying now that someone is never a nobody, they're always a somebody.
That's right.
And people have to remember that, whether you're in a nursing home, visiting people.
Absolutely.
That person has lived a long life, just like you. And when think about it, you lived a very brilliant career. And
Thank you.
And yet if you wound up somewhere and nobody knew you, they should know that you have lived a great life and that they should treat you that way. And yet there's some people who are just a mother or father, didn't have the life you had, but they're still somebody.
Yeah, that's right. And I think you always have to treat everybody with respect. And I think you always have to treat people, again, like they're a member of your family. Now, there's sometimes we have difficult patients. It's not always an easy situation. We have some very difficult patients to take care of. But I think just showing some understanding. I mean, showing empathy is really, and kindness is really something, that there's just an innate quality, and you can't teach people that. They either have it or they don't. And I think that's why people survive in medicine, because they're there because they want to be and they want to help others.
Maybe it's a good time to talk about the fundraising we're doing at Broward Health for all the changes. I mean, the Children's Hospital, for example, but more importantly for me, the Broward North. And my mother, once before we knew she did have Alzheimer's of the Lewy body type, but I used to take her. I first went there to the what they would call the Memory Disorder Center. I never called it that. I called it the Memory Center because my mother wouldn't want to go if it was the Memory Disorder Center. And we took her there, and of course Dr. Todd was in charge, and
yes.
And a lot of things happened from that many years ago, and now it's very exciting that they're raising about $80 million. So I say to our listeners, so many of you are loyal listeners for 25 years or more, you can always put a little bit away in your will for the Broward Health Foundation. They do such extraordinary work, and it's so nice. And all of a sudden, I just heard about somebody else. They're leaving $2 million to this organization, and just think it's in your name, and you live on forever.
That's right. Exactly. I think one of the things that's really exciting as we move forward, and I wanted to touch on before we finished the interview, is I wanted to make sure I talked a little bit about the research initiative. We're actually gearing up our whole research initiative, and we're providing some increased infrastructure, which I'm really excited about, and I will be in charge of part of that because I've done a lot of research in the past. But I'm really looking forward to it because now we have a new opportunity because we've now partnered with FIU. And with FIU, my counterpart has his office right next to me, and we're going to be working together. And I think, when you're a medical student or where you're a resident or a resident, I should say either medical student or resident, there's so many opportunities for research. And now with some of the new requirements for training, it's not like you can go back and review things. You got to do some original research. So we're really very excited about gearing that up. And we have a great pediatric research and a great cancer research now, and also AIDS. Tremendous amount of research being done at Broward Health. And we're really trying to even expand that more because we're gearing up with an officer of human protection, also a director of our research, and then a nursing director. So we've also going to expand our investigational review board to 2 people. And in fact, we had the meeting today, and we have the IRB where we look at all the new studies that are being done. And I'm really excited about the number that we're reviewing. But we're going to expect that to increase because with the graduate medical education program, we're vastly increasing that. We've been affiliated previously with NOVA, which is the School of Osteopathy. But now schools are actually transitioning over to the ACGME, and that's the MD equivalent of the AOA for training. And so whether you're a DO or whether you're an MD, you'll still come out with an AGCME training, and that's a big initiative. And not only are we doing that, but we're also expanding the number of residents across the board.
I'm going to offer you something because in every issue of Boomer Times, I have something called Medical Minds, and I've used Scripps, I've used Israel. There are always research projects going on, and I think that the public that reads Boomer Times, they always want a little bit more, and so I've been doing that. So let me offer that to you. As you have some interesting research and clinical studies, let me have a shot at it, and I'll put it into our magazine because I think our public now is so much more sophisticated. It always amazes me that now, instead of having your doctor tell you what prescriptions you should have, the public tells the doctor what prescriptions because of all the advertising.
It reminds me of a book I just recently finished by Dr. Eric Topol, who is the head of Medscape. And the name of the book is The Patient Will See You Now. And
that is great.
It's really very interesting book.
The Patient Will See.
Yeah. And I actually just finished that about a month ago. And it's really some of it's a little far out, but it's really very good. And it talks about how, as you just stated, patients are becoming much more sophisticated. They've got the internet, they've got Wikipedia, they've got a lot of different sources of information. And so when patients come into the office, it's not like they're coming in, unarmed, if you would, or not being prepared. And they'll come in with some articles and some other things. And, that really, I think, helps challenge a doctor to keep on top as well. But I think, we're just saying people take over more and more of their own health and in terms of their health care because, who has a better vested interest in your health than you? When you stop and think about it.
Of course. So let me ask you a question, because I think I know the answer just knowing you enough. Don't you think that attitude of people is almost like a prescription, that good attitude helps heal people?
Oh, without a doubt. I think we were talking when I was at my previous position at Memorial Hospital Pembroke. This is a funny story, but I had a young doctor. Well, young, he's probably 35, and he is a very good doctor. He's actually Syrian, and he's been in the community for a while. Very good doctor, and he did a really great job, but his patient satisfaction scores were terrible. So I watched him and observed him one day. So I said, "Can I talk to you?" And he said, "Yes," because we were on a first name basis. Well, I talked to him by his first name. He never called me by my first name, which he could have. But I told him, they're just, I think it would make a huge difference if you would just sit down instead of standing while you're talking to your patient. Well, it's funny because he immediately, his scores went up, started to go up, just because he was spending time. And I even took a picture and showed it because he was not like that at all. But he would sit and talk. Then they took a picture and they posted it in the hospital of him sitting down with the patient. So about 3 months later, I noticed his scores started to get worse again. And I said, "I bet you're not sitting down with the patients." And he said, "You caught me again." But it's kind of funny and humorous. But I think at the same time, it makes a point that patients want to have their doctor sit down. They want to feel that they're really interacting with their doctor. But most importantly, they want their doctor to communicate with them. They want to not only tell them what the plan is, and you can do that in a very nice way in a very relatively short period of time, but they also want to be able to ask the doctor questions. And those are the two hardest questions to get doctors to understand because, when we looked at some of our patient satisfaction surveys, which they called HCAPs, I found that probably over 90+% of the doctors, the patients trusted and liked. But it was the second two questions that I had after really work with them. And it just goes to show you how something very simple can be perceived as being really caring. And it is caring. If you're sitting down long enough to speak with someone and listen to them, you have to care about them or you wouldn't do that.
Well, so many times people will say, "I go to the very finest doctor, but he has no patient..."
Bedside manner.
That's right. No bedside manner. And it is hard because... And how do you get someone to have bedside? Isn't it natural? I mean, that's what you're telling me. It's not so much. You're saying you can help them.
I think you can help people. It doesn't mean that you're going to change their underlying personality, but you can certainly change how they interact with patients. Because I've seen it, and I've seen the scores go up. Where I was before, we started with terrible patient satisfaction scores. We narrowed it down to the doctors. I showed them their scores, and I said, "We're going to start working with you," and rounding, and immediately just talking to them about it and showing them their scores started going up, and they started off, I think, at 50%, and they were up to almost 80% when I left. But it just shows you that you can't change people's personality, but you can certainly change their way they interact with their patients.
Yep.
See, I don't care if I have a good cardiac surgeon. I'm not so concerned about their bedside manner. I want them to be a good cardiac surgeon. But if you got someone who's caring for you as a family practice physician or an internist or a medical subspecialist, you certainly want to feel like you're having an engagement.
And so the difference is, and you are old enough to know the difference of doctors being thought of as gods compared to now, you're friendlier, your people have said they still feel that way. I mean, I still think if someone is really very ill, there's nobody else, including their family member, that gives them the confidence in that doctor.
I think that's true. But I think, it's really changed. Instead of being the dictator of the ship, you are the captain of the ship, but you're just one of many people on the team. I think we've really seen medicine go from an individual to really a team sport. I hate to use that comparison, but it really is because I think physicians are starting to realize the benefits of working as a team because it really helps everyone on the team when there's that interaction. And I think we had that at North Broward when I was practicing there with my partner. We just felt like they were just part of our team. They were just part of the team, and we had a lot of trust in the nurses. They had a lot of trust in us. But that's how it has to be. And we talked as each other as maybe equals. As far as I'm concerned, it was equals. But they may not have felt that way. But I felt like I was talking to them. We'd talk not in front of the patient, but we'd talk by first names. And, in terms of working together, and it really built a great relationship. But it kind of goes back, if you played team sports, and I did many years ago, I think that kind of goes back to that whole concept that you can't be a great team by being just an individual player.
So what would you tell young people who are looking to get into the medical field now? Would you say that it's a great thing to do?
Well, I think so much is driven by the person's own, I don't know what I would say, probably by their own
passion.
Self-motivation. By their own self-motivation. I think that, it really depends on what your mission is. If you really have someone who's empathetic, who wants to help others. I don't care whether it's someone who's going into nursing school, physical therapy school, respiratory therapy school, or being a CRNA, or being a nurse or a physician. It has to be driven from within you.
Yeah, and I'm really very, very impressed with so many of the doctors that I know. So what we're going to do is we may just have you come back another time. We're going to say thank you very much for taking the time to do this, Dr. Westphal.
Always enjoy seeing you,
Yes,
Anita. It's great to be back on your show again.
Yeah, thank you. Yes, and we'll catch you with some more later.
Thank you,
Dr.
Thank you so
Westphal.
much.